Okay. Okay. Like, okay. All right, come in closer. Yep. Okay. All right. So this video is for the assessment of teaching a colleague. It's on the administration of an oral medication, whereby the objective is to accurately describe the administration and preparation of an oral medication, and I'm primarily just focusing on the safety and education aspects for the patient. So essentially the nurse is responsible for ensuring that they have the knowledge of pharmacology, of anatomy and physiology, and what else? Oh, the legal issues, big one, to ensure that they are correct. They're giving the correct drug, so it's the correct administration of the drug.
Yeah.
And another big thing that's really important is that the patient has the right to be informed about the name of the drug, what the drug does, and any adverse reactions that they might have potentially. And they've also got the right to refuse the drug as well. So I guess the main strategy for reducing the risk of a drug error is by using the 6 rights, mainly used in hospitals and other sites which may have more rights or might only have 5 rights. Some of them have 7. I think they have a few more. For this purposes of this assignment, so this is for 6 rights. So the first one is the right patient. So you'll be looking at making sure that the right patient, they're looking at their name, so their full name, their first name and last name. You're looking at their date of birth, their medical record number or UR number, depending on which healthcare site you're at, and the ward or clinic. And secondly, the drug as well, so checking against the treatment order. So for example, I've got paracetamol here. So this is just 500 milligrams of paracetamol. So yes, you're looking at the generic name, which is paracetamol, the strength 500 milligrams, and the dosage form. So this will be given orally. So thirdly, the dose. So doses. So checking again the treatment order, that it is the paracetamol 500 milligrams, and if the doctor's ordered 1 gram or 1,000 milligrams, then it's going to be two of these tablets because each tablet has 500 milligrams. So the fourth one is route. So checking on the treatment order that it says oral, so this one you'd be giving it orally. Fifth is the time, so due to be given. The drug will be due to be given within 20 minutes of when it's due. So say it's 8 a.m. you're going to be giving paracetamol, then you need to be giving it within 20 minutes. So if it's 8 a.m. that it's due, you'd be giving it by 20 past 8 and not after. And the last one is the documentation, so ensuring that the drug has been administered. You then sign for it as soon as it's given, not before. And that also includes if you've gone to administer it to a patient and they've refused, so then you'd come back and you write down that they have refused it, or that it's been omitted, or that they have in fact taken it. And so just on the treatment order again, that we're checking this against, you'll be looking for the doctor's name, so the printed name, the doctor's signature, and also the date. So a clear description of the drug and what it does, what it's going to be doing for the patient. The route, so how that's going to be given, so this orally, the time that they want it to be given, or it might even be intervals of time, might be 8 a.m. or it could be 8 a.m. and 12 p.m, etc. If the treatment order's not complete, then you don't administer it, or if you see that the treatment order it looks complete but you can't read it, if it's not legible, then you need to get in touch with the doctor to confirm before giving it, because otherwise you're not sure. And additional checks which are pretty important, and they run alongside the 6 rights, is checking for the expiry date. So once again, on the paracetamol, you see that on on the end that'll say the expiry date, December 2019, just in date.
Yep.
And also checking allergies that the patient may have, or any previous adverse reactions that the patient has had before. And also educating the patient and answering any questions that they might have, like if they're unsure what this does. It is your responsibility to tell them it is their pain relief, what it's going to do, any kind of adverse reactions that it might have, and importantly gaining their consent. Like, hey, for example, if you're giving it to Joyce Coombe, you're saying, hey, Joyce, got this for you. Do you want to take it? If she says no, you don't give it to her. If she gives you consent, then you can give it to her. And then I guess at the end you're assessing the effects, so you're monitoring the patient for the therapeutic interaction, so making sure that it has worked. So for example, the paracetamol, once again, you're going into Joyce and you're asking her, Joyce, are you in half an hour, Joyce, do you still have pain? And that might just be enough for something like as simple as this oral medication. In asking the patient if they're in pain still. For other medications, you might need to use other things, like you're asking them whether they're feeling okay, and you're also physically checking on them, so observing what they're like, and it may be a matter of taking a set of vital signs as well. Yeah, cool. So that pretty much covers the real nitty-gritty stuff for, I guess, the safety aspects and education for a patient. Now, Lily, I'll just get you to read through the 6 rights again, and I guess the importance of the safety aspect for a registered nurse that's administering an oral medication.
Yeah.
Yes.
Cool. Got it?
Yeah.
Okay. What do you say that?
Yeah.
Okay. Alright, so we've got the most important thing is the 6 rights. So we've got to make sure that we're giving it to the right patient, it's the right medication, the right dose, we need the right route, which we'll have on the medication chart. And we should always give tablets orally, so you never crush them. We need to be checking that it's the right time to give, and that it's within 20 minutes, and do the right documentation straight after.
Yep. Yeah. Great. Perfect. Yes. And the responsibilities of the nurse?
Yeah, so we should ensure, so we should know all our anatomy, physiology, pharmacology, to know how the drug's going to react with the patient. We also need to find out some patient background as well, if they have any allergies, if they can swallow the medication, and we need to come back and see if they have any adverse reactions or...
Beautiful.
Check on them, see how it goes.
All right. All right, I think we've got it.
Good?
Okay, thanks, Lily.
Cool. All good.